The triceps tendon reflex can be elicited when the triceps tendon is hit with a reflex hammer. To do this procedure, you need to have your patient lying sat on the examination table and support his or her flexed arm from under the elbow. Then, you need to find the triceps tendon and place your thumb over it. Then, you need to strike the triceps tendon or the distal part of the muscle belly. If you have a very sensitive patient, an alternative method is for you to place your thumb over the tendon and strike it indirectly. A positive response is characterized by the smooth, rapid contraction of the triceps after the tendon has been stuck, followed by a return to the normal resting tone of that muscle. You need to look for signs of upper or lower motor neuron lesions. The biceps tendon reflex is elicited when the biceps brachii tendon is hit with a reflex hammer. This will induce a contraction of the biceps brachii. To do this procedure, you need to have your patient laying sat on the examination table and hold the arm right at the elbow. Then you need to find the biceps brachii tendon and place your thumb over it. Then you need to strike your own thumb with a reflex hammer so you can see the response. A positive finding is characterized by the smooth, rapid contraction of the biceps brachii after its tendon has been stuck, followed by a return to the normal resting tone of that muscle. When performing this reflex, you need to look up for signs of upper or lower motor neuron lesion.
In the brachioradialis reflex, the patient's arm should be supported, identifying the brachioradialis tendon at the wrist. It inserts at the base of the styloid process of the radius, usually about 1 centimeter lateral to the radial artery. If in doubt, ask the patient to hold the arms as if in a sling. Flex at the elbow and halfway between pronation and supination, and then flex the forearm at the elbow against resistance. The brachioradialis at its tendon will then stand up. Place the thumb of the hand supporting the patient's elbow on the biceps tendon, while tapping the brachioradialis tendon with the other hand.
This reflex is most easily done with the patient seated and with their feet dangling over the edge of the exam table. If they cannot maintain this position, have them lie supine. Identify the patellar tendon, a thick, broad band of tissue extending down from the lower aspect of the patella or knee gap. And if you are not certain where it's located, ask the patient to extend their knee. This causes the quadriceps or thigh muscles to contract and makes the attached tendon more apparent. Strike the tendon directly with your reflex hammer. Make sure that the quadriceps are exposed so that you can see the muscle contraction. And in a normal reflex, the lower leg will extend at the knee. This test checks the femoral nerve in L3 and L4. The ankle jerk reflex or the Achilles reflex checks the sciatic nerve in S1 and S2. This is most easily done with the patient seated and with their feet dangling over the edge of the exam table. If they cannot maintain this position, have them lie supine, crossing one leg over the other, or if they fail to do that, arrange the legs in a frog-type position. Identify the Achilles tendon, a taut, discrete cord-like structure running from the heel to the muscles of the calf. If you are unsure, ask the patient to plantar flex, which will cause the calf to contract and the Achilles to become taut. Position the foot so that it forms a right angle with the rest of the lower leg. You will probably need to support the bottom of the foot with your hand. Strike the tendon directly with your reflex hammer and be sure that the calf is exposed so that you can see the muscle contract. A normal reflex will cause a foot plantar flex or it will move into your supporting hand.
The jaw jerk or the masseter reflex is a stretch reflex used to test the status of the patient's trigeminal nerve and to help distinguish an upper cervical cord compression from lesions that are above the foramen magnum. It is classified as a dynamic stretch reflex. As with most other reflexes, the response to the stimulus is monosynaptic with sensory neurons of the trigeminal mesencephalic nucleus sending axons to the trigeminal motor nucleus, which in turn innervates the masseter. This reflex is used to judge the integrity of the upper motor neurons projecting to the trigeminal motor nucleus.
The test consists in loosely holding the middle finger and flicking the fingernail downward, allowing the middle finger to flick upward reflexively. A positive Hoffman's reflex and finger jerks suggest hypertonia but can occur in healthy individuals. The palmomental reflex consists in a twitch of the chin muscle elicited by stroking a specific part of the palm. It is presented in infants and disappears as the brain matures during.
Next reflex is the open aim. To do this, your patient needs to be sitting and you need to grasp the lower leg with one hand. Using the opposite end of a reflex hammer or your thumbnail, you need to use your other hand to scratch along the crest of the patient's tibia in a downward motion. The Babinski reflex is normal in children but should disappear after the child is 2 years old. To do it, you need to rub the lateral side of the sole foot with a blunt instrument. You should have a flexor or extensor response.
The rearing reflex is a reflex that is seen in normal newborn babies, who automatically turn the face toward the stimulus and make sucking, rooting motions with the mouth when the cheek or lip is touched. The reflex is a reflex elicited by repetitive tapping on the forehead. The afferent sensory signals are transmitted by the trigeminal nerve, and the efferent signals come back to or